right, so I'm going to ask you some questions to see if it's something that you can qualify for.
Okay.
Because I tell you, this is a big, big deal here. And these are simple yes/no questions. Just go ahead and answer them to the best of your ability. If you don't know what I'm asking, just obviously, if you don't know what it is, then you probably don't have it. But I tell you, this absolutely eliminates a lot of people that I talk to. Most people don't understand how difficult it can be to qualify for something like this.
Yeah.
So, are you currently confined or scheduled for admission to a hospital, nursing facility, or assisted living facility, or are you receiving home health care services?
No.
Do you require or receive any assistance with bathing, transferring, toileting, eating, or dressing?
No.
Are you currently bedridden, or do you use the assistance of a wheelchair, walker, or motorized mobility aid?
No.
I can't tell you how many seniors I talk to that are using the walker to help them get around just for stabilization.
Yeah.
It's a big deal. Within the past 2 years, have you been diagnosed with a terminal illness or been hospitalized more than 2 times, received home health care services more than 3 times, or been confined to a nursing facility for more than 30 days?
No.
Been diagnosed with or treated other than with maintenance medication for angina, heart attack, atrial fibrillation, cardiomyopathy, congestive heart failure, cardiac or vascular angioplasty, stent placement, peripheral vascular disease, coronary bypass surgery, carotid artery disease, coronary artery disease, or heart disease, or have you had heart or heart valve surgery or required the implementation of a cardiac pacemaker or defibrillator?
Nope.
I tell you what, that one right there eliminates a lot of people from being able to do something like this.
I bet it does, yeah.
In the last 2 years, have you had a stroke or a transient ischemic attack, which is a TIA?
No.
Do you have now, or in the last 2 years, have you received medical advice, treatment, or been advised to have treatment, surgery, or taken medication for hepatitis other than hepatitis A, cirrhosis of the liver, or other liver disease?
No.
Major depression, bipolar disorder, schizophrenia, or a paranoid disorder?
No.
Diabetes requiring more than 50 units of insulin daily to control, or diabetes with any of the following: neuropathy, retinopathy, vascular disease, or hypertension requiring more than 2 medications to control?
No.
That's another one that gets a lot of people. There's unfortunately a lot of people that have some of these health issues.
Yeah.
Chronic kidney disease, Addison's disease, renal insufficiency, renal failure, or any kidney disease requiring dialysis?
No.
Pancreatitis, or any condition requiring an organ transplant?
No.
Internal cancer, leukemia, malignant melanoma, Hodgkin's disease, or lymphoma?
No.
Have you ever had any cancers?
Actually, I had a melanoma under my arm recently. 6 months ago, maybe. First.
I know that for some things, I mean, that's a pretty scary thing to be diagnosed with something like that.
Yeah.
Okay. Any alcohol or drug abuse?
No. Not except daily.
Okay. But it's not something that you've been hospitalized for, or your doctor's recommended hospitalization for? Okay.
No.
Any paralysis, hemophilia, osteoporosis with fractures, or unrepaired aneurysms?
No.
Paget's disease, rheumatoid or disabling arthritis, systemic lupus, or other connective tissue disorder?
No.
That one there gets a lot of people too.
Yeah.
All right. Do you have now, or at any time, have you received medical advice, treatment, or been advised to have treatment, surgery, or taken medication for the following conditions: Parkinson's disease, myasthenia gravis, multiple or amyotrophic lateral sclerosis, which is Lou Gehrig's disease, muscular dystrophy, cerebral palsy, dementia, senility, Alzheimer's disease, or organic brain disorder?
No.
That's another one that gets a lot. There's unfortunately a lot of people out there with some memory issues.
Yeah.
Emphysema, chronic obstructive pulmonary disease, which is COPD, chronic obstructive lung disease, which is COLD, or any chronic lung or respiratory disorder requiring the use of oxygen?
No.
Any amputation caused by a disease or organ transplant other than cornea transplant?
No.
Have you ever been diagnosed or received medical advice or treatment from a physician or an appropriately licensed clinical professional acting within his or her scope for acquired immune deficiency syndrome, which is AIDS, AIDS-related complex, ARC, or human immunodeficiency virus, HIV infection?
No.
Do you have now or in the last 3 years, have you received medical advice, treatment, or been advised to have treatment, surgery, or taken medications for anemia requiring repeated blood transfusions or any other blood disorder?
No.
Has surgery been advised but not performed, or is any surgery anticipated, including but not limited to joint replacement or cataract surgery?
No.
Do you have any medical tests other than mammograms, pap tests, colonoscopies, or PSA tests which were advised for routine screening purposes only, treatment or therapy that's been advised but not performed?
No.
In the last 2 years, have you had PSA levels greater than 6.0 or been diagnosed with dysplasia of the cervix classified as level 3.0 or higher?
No.
And in the last 2 years, have you taken any medication for any heart or vascular disease other than high blood pressure?
No.
All right, now I need to get a list of the prescription medications that you're taking. Can you go grab that? Do you have a list, or can you want to just grab the bottles for me?
I just tell you, I take one prescribed, actually 2 prescribed meds. And they're both for my eyes, for dry eye basically.
Okay.
That one is morning and evening in my left eye. And that's the only prescription actually. This is over the counter.
That's over the counter?
Yeah,
Okay.
that's,
And how long have you been taking
oh,
this
wait,
for?
wait. I have one more. That's the wrong one. I've been taking this for, I would say, a year,
Okay.
maybe a year and a half.
And what's it for?
It's for glaucoma or,
Glaucoma?
yeah, eye pressure.
Okay. And the Travertan, how long have you been taking that for?
That's the glaucoma one. This one is also for that. They're basically the same thing.
And about a year on it as well, year and a
Same,
half?
yeah.
Okay. Okay,
That's it.
all right. And in the last 2 years, have you been prescribed any other medication that you can think of, or you remember?
No.
Okay, not a big deal. All right, how tall are you?
Well, I used to be 5'4". I think I'm 5'3.5" now, but
Okay.
I don't like to admit it.
Well, then we'll still, we always round back up to the full inch, so we'll go
Okay.
5'4" still.
Okay,
How much do you weigh?
130.
Okay. Let me just check something really quickly. I'll tell you what, when it comes to this right here, it's fantastic. You just qualified. You should be so proud of the way you've taken care of yourself. That is a big
Great.
deal.
That's great.
So to kind of go over and reiterate where we're at, obviously you've got currently a Plan F coverage, which was good coverage.
Mm-hmm.
But you don't have any of the benefits, the innovative benefits that Medicare talks about in
Right.
the book. We know that the company, obviously the philosophy behind it is kind of caused you a lot of concern.
Mm-hmm.
It's got some issues when it comes to the conditionally renewable because
Yeah,
of the group
absolutely.
policy.
Mm-hmm.
And it's not the best plan for you for the rest of your life.
Right.
You qualify to get yourself into full coverage that's going to include not only all the benefits that the Plan F has, but help paying for things like your prescriptions that Medicare doesn't cover, your dental, your hearing, your medical transportation, your eyeglasses. Okay, it's even going to include an extra $5,000 like we talked about back here.
And that's a life benefit if you don't use it right.
Yeah, $5,000 for your when you pass away, for your family to help pay those bills.
That's great.
Okay, now, like I said, that's a big deal. I can't tell you how big that is. Now, let me tell you what my job is to do, because obviously my job is to make sure that you don't have to take care of any of this.